everyone. My name is Dr. Ben Buchanan, and I'm a psychologist and also the co-founder of NovoPsych. It's my great pleasure to be hosting tonight's webinar with Dr. Matthew Smout. Um, Now, I think one of the reasons why I love doing webinars is that it really bridges the gap between science and what academics and researchers are doing and what's happening in the therapy room. As I hope many of you know, NovoPsych is designed to give clinicians evidence-based tools to improve outcomes. And the presenter tonight, Dr. Matthew Smout, is an author of one of these questionnaires, the Valuing Questionnaire, which is a questionnaire used in acceptance and commitment therapy. One of the reasons I'm keen for the Valuing Questionnaire is that I've personally been administering it to myself for probably 3 or 4 years, about once a month, where it helps me track whether I'm living consistently with my values. And in clinical practice, I've been using it with my clients for the same period of time, and they've found it really useful. And for all the clinicians in the audience who are working with clients, you know how essential it is to keep clients on track and motivated and having a sense of progress in their therapeutic journey. And I think that the Valuing Questionnaire is a tool that really allows that to happen. Let me introduce Dr. Matthew Smout, who is a clinical psychologist and program director at the Master of Psychology program at the University of South Australia, where he teaches, conducts research, and supervises. His research focuses on how to improve the effectiveness of psychological therapy in routine practice and involves developing questionnaires that better track client progress. Academic highlights include conducting the first randomized controlled trial of acceptance and commitment therapy in Australia, co-developing the Valuing Questionnaire, benchmarking student clinic outcomes, and co-authoring the Cambridge Guide to Schema Therapy. Hey, Matt, welcome to the webinar tonight, and thank you so much for presenting.
Thanks, Ben. Thanks for having me.
So I wonder if I can ask, what first got you into ACT?
It was quite accidental, actually. I was in my first job, and my placement supervisor, who happened to work in the same organisation, came in and slapped the book down and said, "This is the book that I've always wanted to write." He said, "This guy, Stephen Hayes, has married radical behaviorism and Buddhism together." And so I went away and read it. My wife, who's also a psychologist, read it, and we were both super intrigued. And then she had the opportunity to go to the States the next year and catch one of Steve Hayes's first workshops at Lake Tahoe as a retreat, and she came back buzzing and gave me all this information to read. So I was kind of hooked by then. This is, I think, 2001.
Right. Wow. And then the rest is history. And you've done a randomized controlled trial, and authored a questionnaire, and here we are tonight. So that's an interesting start, being at the sort of ground floor of ACT.
Yeah, it was much easier to do ACT presentations back then because it didn't take very long to cover the literature that was available, and that was good. Whereas now there are well over 1,000 randomized controlled trials. It's been really amazing to see how it's exploded in popularity, and it's nice to have been a bit of a part of, I guess, disseminating the approach in Australia in the early days.
Okay, great. Well, I'm going to hand over to you. There might be some questions fired at you in the chat throughout, which I'll feed to you, but take it away.
So I'll spend a moment tonight explaining what values mean according to ACT definitions, and I'll just give you a little bit of a rundown on some of the common interventions that people use to help people achieve clarity in their values. But most of the talk will be on the VQ. I'll tell you about reasons for developing it, how it relates to other measures, and give you lots of examples of the kinds of values that have come out in studies with different populations, and also some case examples that I've worked with and my students have worked with, and briefly just mention some of the limitations to it at the moment and alternatives. Let's start with how ACT defines values, and the definition on your screen there is quite cumbersome and jargony, but it's freely chosen, verbally constructed consequences of ongoing, dynamic, evolving patterns of activity which establish predominant reinforcers for that activity that are intrinsic in engagement and the valued behavioural pattern itself. Now, if you're not really immersed in both behaviour analytic writing and relational frame theory and a really ACT devotee, most of those phrases probably sound like nonsense. So let's break that down a little bit. I'll point out that we worked to this definition when we developed the VQ because that was the most refined and well-accepted definition of values at the time that we were developing the VQ. And it was very similar to the definition that was published in the second edition of the sort of main ACT textbook by Steve Hayes, Kirk Strussel, and Kelly Wilson. But by breaking it down, the first bit, freely chosen, means that subjectively, the individual experiences their values as what they choose to see as important. So even if we could do an objective scientific analysis and could identify all the biological and social influences on people's values, and of course we do those kinds of studies, to the individual experiencing their values, they at least enjoy an illusion of free will, and so they experience their values as what they choose. And related to that, values can be distinguished from ways that we behave that are controlled by obedience and compliance to social norms, or the things that we do to avoid disapproval or punishment. And values are also not deduced just from logical reasoning. We choose them just because, without defense or justification. So it's pretty inherent to an ACT definition of values. We don't justify, we don't defend our values. They are a starting point for how we choose to evaluate how we're going in our life. The second part, the verbally component of the definition, is to signify that language is required for values. Values don't arise, according to ACT theory, just from direct contingency-shaped learning alone. In other words, the kind of learning that most animals on the planet have to rely on because they don't have a rich verbal language system where they can anticipate the future very far in advance and run mental simulations and all those kinds of things that humans can do. So one of the key properties that makes values useful is that they allow us to behave in a way that can be regulated by distant consequences in time when there are no sort of immediately available consequences to reinforce our behavior. So it's a topical example, I guess, but we can work towards minimizing the long-term adverse effects of climate change, even if the main reinforcers in the short term or the main consequences that might affect our behavior are things like inconvenience or conflict with others and financial expense. So without the ability to have values, that long-term mental envisioning and understanding, our behavior would otherwise be thrown off the course of pursuing those kind of long-term valued outcomes. The constructed component, the number 3 bit, means to emphasize the active agentic quality of valuing. So to value something is to perform an action, and we don't reduce values down to personality characteristics or traits that are below the level of sort of voluntary behavior. The fourth part is ongoing, dynamic, evolving patterns of activity, and this refers to how the specific behaviors that would serve a value will often change over time and situation. So, for example, being a compassionate therapist will sometimes involve listening attentively without speaking to a client, but other times it might involve empathically confronting self-defeating behavior. Both behaviors, that is, listening without speaking and confronting, could both be executed in the service of the desire to relieve suffering, and which action best serves that purpose depends on the needs and the abilities of the client. The fifth part of the definition is values establish predominant reinforcers, and this refers to a key property of values. they make some behaviours and their consequences more important than others. So values give actions their valence. And 6, intrinsic in engagement in the valued behavioural pattern itself is a slightly cumbersome way to say that enacting your values is intrinsically reinforcing. So, in the ACT text available at the time of developing the VQ, the concept to me was a little bit nebulous. In fact, one of my motivations for developing the VQ was to get a clearer idea from ACT experts as to what, in fact, valued living should be like. So the best that I could infer from books at the time was that 1, individuals could vary in how clear they were about what was important to them. 2, values vary in priority, with some more important than others. 3, they were freely chosen and not the behaviours we perform out of social compliance. 4, they guide behaviour, they are enacted. 5, they're independent of moment-to-moment state emotions, and this is partly how they're useful. They guide our actions in ways that should fuel our long-term satisfaction, even if they involve momentary discomfort or unwanted emotional states. So I sometimes use the example to make this point very clear. Rescuing your child from a burning house would be important. It might not be pleasant. Or conversely, binging junk food may feel hedonically pleasant, but might not be very valuable or important. 6th thing I got from ACT books at the time, the ACT authors anticipate that people should feel some kind of positive quality when engaging in valued action that is different to pleasure or comfort. And they tend to describe these feelings as engaged or feeling vital. And I have to be honest, I don't always know what those words mean either, but hence the search. Values were always described as relatively consistent and stable. So one of their useful qualities is that they're compass-like, hence the little symbol on each of my slides. So their values act to point you in a consistent direction, even when your emotions drive you to behave in more inconsistent and short-term ways. So hopefully that gives you a bit of a theory for where we're coming from. And these examples taken from one of my favorite ACT self-help books. This is Kirk Strassel and Patty Robinson's Mindfulness and Acceptance Workbook for Depression. But you can see some concrete examples there. I want to be well educated and pass on my knowledge to other people. I want to be a loving, kind, responsible parent for my children. I want to be a spiritual being, and I'll honor all forms of spirituality in others. I want to be a loving, compassionate, and supportive life partner. I want to continually challenge and improve myself as a person. I want to promote a safe and healthy life for animals. I want to contribute to my community by performing acts of charity and volunteerism. I want to improve the lives of people who are economically challenged. I want to promote my physical and mental health over my lifespan. I want to protect the earth and promote a clean, sustainable planet. I want to be there for anyone I care about in his or her time of need. So as you can tell, they're kind of like mini mission statements for ourselves, statements of what we fundamentally want to be about in our lives. And now the study of values has come a long way since those early days. And this is a really interesting study that Finkelstein, Fox and colleagues did with 112 university students using ecological momentary assessment with daily diary data for 2 weeks. They used a cut down version of the VQ. They used 3 progress items and 2 abstraction items, but they didn't end up reporting on the abstraction data. And they found both trait and contextual influences on valued living, so that trait effects were about twice as influential as contextual effects. So trait valued living was related to the psychological trait resources they measured: mindfulness, meaning in life, and psychological flexibility. And valued living, the extent to which people put into practice their values, was also dependent on daily stresses, with people reporting engaging in less valued living on the days that they encountered more personal stresses than usual. So this is just to give you an idea that when people aren't in therapy and not necessarily working on themselves, they tend to do a better job of being the kind of person they want to be when life is less stressful, which is why ACT's dual focus on changing our relationship to our unwanted experiences and decoupling our pursuit of our values from our emotional states makes such good sense. Now, I'm not going to try and cram an ACT workshop into this seminar, but just to point to some of the common activities that people do in ACT to help people get clear about what their values are. I'm sure most of you will be familiar with these. So first of all, we can divide the values related interventions and acts into two main activities. One is values clarification, where we try to help clients pay attention to and clarify what their values are, what's important to them. And the second part is putting them into practice. So within the values clarification exercises, you may have come across the funeral exercise. This is where we might invite a client to sort of imagine magically attending their own funeral with all the most important people in their life, and imagine what they would like those people to say about them and about the life that they lived, about what they stood for, the kind of person they were, as a way of fueling some reflection. Sort of a related way, we might ask people to write what they'd like on their tombstone or their headstone, write an epitaph to their life. So to take a similar sort of narrative to the funeral exercise and distill it into a pithy sentence, much like the examples in the previous slide. For those who want a more concrete type of task, you can do values card sort, which I think originally came from motivational interviewing, but involves having a range of different values written on cards and inviting a client to sort those into piles of important and not important, and to choose the most important cards from the important pile. There are various worksheets that help clients write narratives about the kind of person they want to be, often in different domains of life. So how we want to be as a partner in an intimate relationship, how we'd like to be as a parent, how we'd like to be as a family member of other members of the family, a brother or sister, son or daughter, how we'd like to be, physical life, taking care of ourselves, what kind of importance we want to give to taking care of our bodies and the kinds of ways we want to do that, and so on. And one of my favorite ways to help people get at the kind of values that they aspire to is to ask them about role models, ask them who they admire and what they admire about them. And from values enactment point of view, it's very similar to behavioural activation, where we with a focus on scheduling activities towards goals that are consistent with a person's values, all the time using other kinds of ACT strategies to manage the kinds of psychological experiences that might otherwise interfere with engaging those activities. So going into the next slide, so when it comes to measurement, it's been difficult to develop self-report measures how clear people are about their values. And when we developed the VQ, we kind of ended up giving up on trying to measure that component of the VQ. None of the items that we wrote for it really produced a reliable enough factor that was substantially different from progress factor. So the VQ mainly concentrates on measuring that values enactment component and its converse, obstruction of valued action. And the rationale that we had for developing the VQ was, at the time that the ACT workshops I was going to were placing a lot of emphasis on ACT not aiming to reduce psychopathology symptoms per se, but that it was more focused on helping people live a meaningful, vital life as the goal. And the irony of this was that nearly all of these studies were using symptom measures as their primary outcomes. And there were only a few other sort of measures developed. The chronic pain values inventory had been well validated in pain samples, but not outside them. We didn't really think there was a measure that was both psychometrically sound and usable for most clinical cases. Kelly Wilson had developed the Valued Living Questionnaire, which is probably the first sort of value-specific measure. But it was mainly developed as a clinical sort of intervention tool. It was meant to stimulate people to talk about what was important to them. And the early studies of it as sort of a straight assessment measure were a bit underwhelming. The psychometric properties were a bit mediocre, and so it wasn't all that helpful as an outcome measure for studies. Joseph Cherokee, who was working at the University of Wollongong at the time, had put together a really comprehensive values measure, which was terrific, but it was way too long and cumbersome for sort of a weekly tracking. So we tried to make a measure that was brief enough for weekly use, that would use language that could be understood by clients who hadn't already done ACT, so that they could give valid answers at baseline, and indeed so that the measure could be used with non-ACT interventions to see if ACT interventions really were the most effective things to improve valued living. Nevertheless, we still wanted the measure to clearly reflect an ACT definition of valued living and not refer to specific life domains as previous measures had it all done. So up to that point, the CPVI, the VLQ, a few others, really focused on asking people about those separate domains like parenting, being intimate relationships, friendships, work and education, personal growth, etc. Asking them how important each of those domains were to them, and then sort of either how consistent they were living according to their values in those domains, or how successful. But we wanted to get away from that approach because in real life, always involves choosing between, constrained alternatives. So it's fine in an abstract sense to ask us how important health is to us, how important relationships are to us, and we might say everything is important to us. In fact, my experience with things like the VLQ early on was that people tend to rate most things as important to them. Maybe apart from an Australian sample, spirituality, maybe citizenship. But essentially, we've only got so much time and space. And one of the ways that values are important to us is that sometimes we make decisions to prioritize an area of our life and put a lot of energy in just one or two areas. And that itself is a value choice. So anyone who's had small kids can probably relate to the fact that there's trade-offs. So when you're parenting young kids, you might decide that you're going to put most of your focus into that, and how well you're living your life will be largely determined by how well you're doing at parenting for that time. And you might be putting less energy into your work, or you might be putting less energy into health and self-care activities. Not that that's good practice necessarily, but you get the point. And so the questionnaire we came up with is on your screen now, split up into the two subscales. So two 5-item scales that have remained, and that they're moderately negatively correlated together, meaning to the extent that you're making progress towards your values, or living more accordingly to them over time, it tends to be associated with kind of less obstruction of them. But there's still quite an independent nature to them. 0.4 minus 0.5 is not, they're clearly not so tightly related to each other that they could be reduced to one factor. So I worked towards my goals even if I didn't feel motivated to. I was proud about how I lived my life. I made progress in the areas of my life I care most about. I continued to get better at being the kind of person I want to be, and felt like I had a purpose in life. So that encompasses that sense that I'm satisfied, that I am becoming more and more like the person that I want to be, which we wanted to capture. So that's one of the progress subscale measures. The obstruction subscale has a bit of a range of different things that could drag us away from an experience of valued living. So if we're stuck in the past or the future, ruminating or worrying, rather than being engaged in activities that matter to us, if we feel like we're just on autopilot, so we're disengaged, just going through the motions, but not sort of being attentive to what we're doing. Again, if we've got difficult thoughts or feelings or memories that get in the way of what we want to do. A lack of persistence, so if we just kind of give up on our direction, if things aren't going the way that we hoped. So there's a bit of a diversity of factors that could take us off our chosen path, but they all load fairly cohesively together. And all of these items are rated on this scale you see at the bottom from 0 to 6, not at all true to completely true. It just follows the same format that some of the other ACT scales are used at the time. Sorry, Ben,
Hey,
you
Matt,
got to say something?
yeah, I've got a couple of questions for you coming in from the chat. Someone's asked, these sound a bit like personal goals. Are personal goals essentially values?
Great question. And from that perspective, no, not exactly. Goals are different to values in the sense that values are directions. You never really complete moving in a direction. If you use the compass analogy, values are like your north, and there's always more north to go. Um, Goals are destinations. They're discrete places that we aim to get to. And once we've got there, we've achieved those goals, and then we need to set new ones to move us on further. So there's obviously a relationship there, and hopefully, if we're living a good life, the goals that we set are consistent with our values, so they're in the same direction of the kind of person we want to be. But there is a distinction. But
Yeah.
probably should give a non metaphorical answer to that too. So if I value being a lifelong learner, I'm never going to be done learning, but I might set myself the goal of doing a course in how to learn French, or how to, or Roman history or something like that. These would be goals that would consist of my value of being a lifelong learner.
Great. Another question comes in. Um, what's the difference between values and responsibility? For example, parenting or personal care?
So I think what you mean by responsibility here is something a little bit more like obligation, perhaps like a sense of something that you do because there will be adverse consequences if you don't do it. And it's important to understand from an ACT perspective that all of our theoretical terms are functional rather than formal, which itself usually takes about 20 minutes to explain, but I'll try and do that quickly in the sense that um, the same behavior could serve the function of, it could serve as a value, or it could serve as an obligation. And the one that was close to my heart as a parent of young kids was, you know, spending time with my children. If I focus on when they were very young, they couldn't say very much, they could do very much, but they needed constant supervision. Didn't get a lot of hedonic pleasure from some of those parenting moments. Watching a child clumsily put a shape into a plastic ball for multiple tries. I could look at that task as an obligation, and if I do, it'll probably feel heavy, and I'll probably feel resentful and so forth. But if I connect with the value, I am growing my child's brain. I'm giving it something vital for its development. I'm nurturing my child. Suddenly that same very activity can serve my values. And so that's kind of the point of this, is that they're not defined by the things that we do so much as just the context in which we do them.
Yeah. And Heather's asked, would values guide our goals?
Yeah, they should. Well, it'd be wise for them to, yes.
Yeah. Cool. All right. I think that's all the questions for now.
No worries, thanks. For those who are brand new to ACT, the driving theoretical construct behind the approach that's been talked about most of the time it's been disseminated is psychological flexibility, or psychological inflexibility as its opposite. The psychological flexibility is intended to be, I guess, the ability that emerges from being good at acceptance, good at diffusing from thoughts, good at adopting a mindful perspective on your experience, good at an awareness of self as something that transcends specific thoughts, feelings, situations. If you're good at identifying what's important to you and good at sticking to being, to living according to your values, that collection of sub-abilities should give rise to the broader ability of psychological flexibility. And conversely, if you are try to avoid your experience, if you are very fused and stuck with unhelpful ways of looking at yourself, the world, and others, if you are inattentive to the present, caught up in worry and rumination, are very attached to a dysfunctional view of yourself, not clear on what's important to you, and not very good at following through on what's important to you, those kind of collections of disabilities, if you like, or difficulties, give rise to psychological inflexibility. So theoretically, this is the organizing behavior that ACT focuses on trying to um, change. So trying to reduce psychological inflexibility and increase psychological flexibility. So that's some background to these next set of measures. And excuse me. So within ACT theory, valued living is just meant to be a subcomponent of this broader ability, psychological flexibility. But even so, you'd expect the VQ to correlate with other measures of psychological flexibility. Now, the AAQ is the Acceptance and Action Questionnaire, and for most of history was the main questionnaire for testing ACT-specific hypotheses and measuring ACT interventions. It's been described throughout its history as both a measure of experiential avoidance, psychological flexibility, or really psychological inflexibility, and most of its items describe thoughts or feelings interfering with life. And later studies have found, perhaps not so surprisingly, that this perhaps measures more closely just psychological distress. But nevertheless, the way it's written, it's not surprising that the AAQ2 correlates highly with the VQ obstruction scale. They are trying to measure a very similar thing. But
So
Ben,
a couple of questions coming through. Someone's asked, could you please explain what you meant by diffusion of thoughts from an ACT perspective?
yeah, thank you for the question. So probably outside of ACT, we might have come across the idea of thoughts not being facts. That there's a, depending on your philosophical position, we adopt the assumption that there is a physical reality outside of our perception of it. But in a sense, when we are fused with our thoughts, we lose the ability to tell the difference between the physical reality outside of our thoughts and the thoughts that we have about that reality. So when we treat our thoughts as though they were facts, things like, I'm a terrible speaker, I'm a lousy husband, I'm immature, those sort of self-judgments, they're all kind of evaluations and they're arbitrary and they're not really properties of me as a person, but they're judgments I might make about me. But when I fuse with them, I treat those judgments as though they were facts and I start basing my life around them. So I might, avoid, if I believe that I'm a lousy speaker, I might turn down invitations to speak, or I think that I'm a bad husband, I might go around doing lots of groveling behavior to try and win my wife's trust back, or I might give up on the marriage and leave it. So it's about the relationship that we have to our thoughts. So that's fusion. And so diffusion is the ability to step back and just see our thoughts as thoughts rather than facts about the world. And so there are lots of traditions, and any form of meditation and therapy derived from it involves some kind of practice where you sit and you just watch what your mind does without interacting with it, judging it, trying to make it go away or control it in any way. And so it's part of that tradition.
Cool. So fusion with thoughts is when you just take them at face value and just believe them. And diffusion is when you can observe a thought as a thought and not necessarily just buy into the content of it. Another question here is, what's the relationship between the VQ and shame?
If you had a high abstraction score, we'd expect you'd have high shame. And your value progress score, if the rest of these results are anything to go by, will just depend on how you're living your values, kind of irrespective of what's going on in terms of your emotional life. So,
and another question, is there any correlation between particular personalities and certain values? I know you said before that values were not traits, values are something that we choose, but surely personality impacts what we choose to value.
yeah, so now you're kind of talking more about the scientific study of values more generally. And so there is definitely research programs gone on there. There are slight differences between cultures, like say something like, I guess, autonomy versus community. It's not quite right, but it's something along the lines of autonomy versus communal values tend to be a bit of an east-west difference. So in terms of personality traits, then look, probably. I'm not actually aware of the research, but I wouldn't be so look at.
And Leanne's asking about what you think about the use of a measure like the VQ in someone that's grieving, particularly in traumatic bereavement.
I think with traumatic bereavement, what makes it traumatic and complicated rather than normal and healthy is the extent to which you engage in failure to accept reality, avoidance of living as though this event has happened, um, being fused with your pre loss ideas. And so I don't see it as any less relevant than anything else. I mean, I think one of the things about ACT's perspective on all suffering really is that the same processes operating kind of regardless of the form that your behavior takes, regardless of the specific thoughts or specific emotions you're struggling with, that ultimately this same set of processes tends to explain why you might be stuck or not thriving. So I kind of don't see, I would see it as relevant to there as I would see it to kind of most applications. Yeah.
Yeah, cool. All right.
Thank you. Where was I? Oh, yes, I talked about the AAQ, and now I'll go on to the Compact is a more recent ACT questionnaire that was developed to measure psychological flexibility. It's a 23-item measure with 3 subscales: openness to experience, which is meant to measure your willingness to experience your thoughts and feelings without trying to control or avoid them; behavioral awareness, which intends to measure mindful attention to your current actions; and valued action, which is meant to measure extent of engagement and meaningful activity. So again, unsurprisingly, the VQ progress scale correlates highly with the Compact valued action scale. And interestingly, the VQ obstruction has a similar strong relationship with both openness to experience and behavioral awareness. And that might be because although the Compact has both positively and negatively worded items on each subscale, there are still more items measuring the negative version. So for example, measuring the construct of openness to experience via an item measuring its opposite, like I work hard to keep out upsetting feelings.
So,
Ben.
Matt, a couple of questions come through. Question on how frequently would you administer the VQ with a therapy client?
Well, it's intended to be suitable for like every session. So at a UniSA psychology clinic, we only use the progress subscale, but we give that weekly.
And other questions come through. What's the best time to administer the VQ? Would you do it before clarifying values with a client or afterwards?
Well, it's intended to be able to be used sort of before you even go through what an ACT definition of values is. Obviously, once people have had that sort of work, we hope that the way they interpret those items has been influenced by that work. But yeah, no, I would take a baseline. And there are some people that come to therapy where the symptom measures, early on don't really explain why they're here. And sometimes the VQ can help make light of that. Just a couple of baseline ones. These are people I've seen recently in private practice myself. This is somebody who's severely depressed, feeling overwhelmed at work, fearful of his depression spiraling to the point that he might need hospitalization. He's even trying to, change his antidepressants and just doesn't feel like he can participate in even basic activity scheduling of self-care behaviors. So he reports not feeling in any way as though he's the person he wants to be. You can see that you can hardly see the bar on the progress chart there. And he reports only moderate obstruction, which I suspect is possibly more to do with inattentiveness than it being a strong guide to how he really is. But on the same time, he's also deeply resentful about his workplace at the moment. So although he's forced to spend a lot of time at work, he doesn't rate that as sort of important. And he's having a lot of troubles with, getting started and getting through the work. So those disengagements probably show from the obstruction scale. In contrast, another client that came through the same week was just simply more dissatisfied with life. So you can see from their PHQ scores down the bottom that not nearly as oppressed and depressed, But dissatisfied and unsure, they're questioning whether they want to stay in their relationship, questioning their work, recognize that they've got some strengths and proud of their ability to be organized, professional, and caring, which might show up in that sort of mid-range progress score, sort of very average score. But he also recognizes that he isn't very proactive, questions whether the fights he's having with his partner mean that he's approaching their conflict wrong or that she has the problem. So perhaps unsurprisingly, he's got that mediocre score on the progress scale. On the other hand, his tendency to worry and ruminate or be disengaged and not proactive is consistent with his higher VQ obstruction scale score. So notice that even though he reports a higher obstruction score than the previous client, even though they're experiencing much milder depressive symptoms. This is another kind of client. This client's been sober for 4 months from heavy alcohol use. They're active in their sobriety. They're sort of reading self-help materials and meditating daily. They present as quite a positive person. They seem enthusiastic and open to learning new things, despite reporting moderate to severe depression on their PHQ-9. They report chronically very high anxiety. So their VQ progress score, which is almost as high as it gets, is consistent with how much they're engaged in healthy living. And at the moment, sort of nothing is more important to them than their recovery. They're very aware of that, and they recognize what they're doing well that's important to them. They notice that even though it's very high progress, they're also still reporting quite a high obstruction score, which in this case refers to how their sort of trauma-related memories and their rumination might get in the way of what they're trying to do at times. This client also had some attention difficulties, so it's also possible that either the obstruction score refers to how their distractibility might interfere with them, or it might be that, again, they didn't quite consistently have a consistent response there. Here we've got and by the way, I didn't make that clear, all of these slides are showing the Novopsych outputs. So if you're using the VQ through the Novopsych, this is the sort of thing you could expect to see. This is just some dummy data based on, like a typical case of what we might expect to see, just so you could see how it would look in a Novopsych interface. So if therapy progress was smooth and linear, we'd hope to see sort of an increase in the extent to which people felt like they had a purpose and getting better at who they wanted to be and feeling proud of the way they lived, and a decrease in the extent to which they're stuck in rumination or worry, mentally disengaged, or giving up in the face of difficulties. And finally, just a couple of cases from our student clinic here. As I say, we only use the progress scale, but we generally administer both. This is our standard sort of weekly questionnaire. It's the PHQ Patient Health Questionnaire, which measures depressive symptoms, and that's the blue lines. The orange is the GAD-7, which measures anxiety symptoms, and then the VQ progress scales in grey. And we only do that because that fits neatly on one page, so it feels like we're not asking clients for so much. But this is pretty like typical successful case. There's a reliable change in anxiety and depressive symptoms, accompanied by a significant change in valued living progress. This is a pretty consistent treatment plan with a little CBT sprinkled throughout, just to clarify some points, but fairly standard intervention. This case demonstrates that although the linear trend shows reliable change in depression, there's also a trend towards reduced valued living. So this is a bit of a mixed bag. We might look, if we just looked at symptom reduction, we might go, okay, this is going quite well. A reduction in depression symptoms, obviously still in a moderately severe, moderate depressed range. But and that's still important. Obviously, we want people to be less depressed. But the fact that the VQ progress scale is also sort of trending downwards is a bit of a concern. And this pattern often happens when people are reducing their distress by avoidance. So they're, feeling less anxious or feeling less depressed, but they're doing that by avoiding activities which also puts them out of contact with sources of pride and sense of progress and achievement. But in this case, it was probably more related to the fact that this person had a very strong sort of self-critical, perfectionistic monologue or dialogue, which I think really interfered with her ability to perceive progress. So she was somebody who was quite busy, but and doing quite a lot of things that were consistent with the values, but she would tend to devalue them or discount them. This is kind of a bit of an appreciate or underwritten about thing in the literature, but something I think I see all the time. So I'm hoping to get something in a study to show that in the coming year. Another case example, this one illustrates where the BQ progress scale captured a sort of positive treatment response where the symptom measures kind of fluctuated and didn't sort of really give us much of an encouraging response. In actuality here, we probably have more like a quadratic trend where the depression and values progressed, improved together halfway through the treatment, but then depressive symptoms sort of deteriorated, while the BQ progress measures still seem to kind of continue in the direction of improvement. So in other words, the VQ progress scale demonstrated a sort of stronger trend of improvement than the symptom reduction measures. And this was an interesting case. This is a case of someone who was quite disabled, a bipolar disorder client who's living with their mother, who's extremely critical, and a lot of the focus of therapy was really on helping the person sort of stand up to their, well, not just stand up to their mother, that wasn't quite it, although that was part of it, being a little bit more assertive, but it was also a heavy emphasis on detaching from the importance of mum's criticism. So again, pretty consistent intervention, and so it's kind of interesting to see that play out, and the client was pretty satisfied with their outcome, even though they're still obviously quite symptomatic. And last example, another good use case for VQ, the symptom measure are both in the non-clinical range at intake, but obviously the client still wanted therapy, and in this case, the client's main reason for coming was to improve their sleep quality. But when we saw the low VQ score, we talked to them about it, and the client ended up sort of wanting to incorporate setting values, consistent goals throughout therapy. And so those sessions were sort of equally divided between cognitive behavioral therapy for insomnia, but also setting values, consistent goals to do with things like initiating communication with their daughters more often, telling them that she was proud of them, talking to her husband, who was also her carer, about his preferences, for how it would suit him to do different tasks rather than just giving him instructions, and then moving on to sort of reaching out to talk to other family members who she hadn't seen for some time. So it reflected that pretty well. I wanted to mention this study quickly because it was looking at comparing the suitability of different app measures for use with autistic people. So they looked at the VQ, the AAQ2, and the more recent alternative, the Brief Experiential Avoidance Questionnaire, and they administered all of them to a sample of 461 autistic adults. They found that VQ obstruction was the highest predictor of depression symptoms, and progress subscale was the highest predictor of satisfaction with life after adjusting for gender, sexual orientation, location, income, ethnicity, and AQ short scores. They said these VQ subscales tended to collectively explain as much or more of the variance in the DAS-21 subscales and the satisfaction with life scales than the AAQ2 and the BAAQ after accounting for demographics. And because each VQ subscale captures some unique aspects of psychological inflexibility together, they offer a more potent prediction of both distress and well-being. The VQ progress subscale places an emphasis on progress toward what truly matters, or said another way, an individual's free chosen values. So this approach is functionally strengths-based, shifting clinical conversations to emphasise what an autistic individual genuinely cares about rather than societal-based social norms that are often frustrating and commonly harmful to the community. And because of this, we suggest clinicians tend toward including measures of values progress rather than strictly psychological inflexibility in clinical work with autistic adults. So I just thought that was kind of interesting, particularly given how much more attention we're trying to give to the needs of the autistic population at the moment. Sorry, Ben, I missed you there.
Cool. Well, why don't we jump into questions? Thank you so much for a really great talk with showing that the VQ has been evaluated in lots of different populations, in lots of settings. Because I suppose one of the things that people often ask me is, how do we know that a measure is good? And of course, there's a lot of work that goes in behind the scenes of validating a measure and making it good. Lots of the questions coming through. One of them is, how would you introduce ACT to a client in session?
Oh, gee, there's lots of different ways to do that, and I'll try and do that quickly. My preferred way really is to assess a client and trying to understand what I think's contributing to their problem, but summarizing that, we might, enact consistent ways. We might emphasize the extent to which avoidance as a coping strategy, how being stuck either in rumination or worry or fused with particular thoughts and feelings, and really the fact they really believe these things is interfering with what they really want to do. And as a result, that they're not really being the person they want to be to the extent they'd like to be, and let that sort of be a segue in.
Yeah, and I like that way you said, well, the way I tend to frame it is say, I think that therapy can help you be the sort of person you want to be. And in order to figure that out, you've first got to articulate your values and then figure out what's getting in the way if you're living consistently with them. Someone's asked, when will NovoPsych be able to overlay assessment results over time? Great question. It can already do it if you administer the VQ more than once to the same client, it will automatically graph it over time. A question is, could the VQ be a useful tool for a client who has a history of therapy dropout as sort of like an accountability tool?
I don't know. Try it. I don't know.
Yeah, I mean, my sense is that in therapy in general, and people want hope, and part of hope is having a sense that people can see progress. It's like, how do we actually quantify progress here? Part of the issue that I find with people when when you're introducing the idea of values versus goals, goals are quite concrete and can be achieved, and we all know about SMART goals, which are specific, measurable, attainable, realistic, and time limited, whereas values are more amorphous. And so the VQ is a really great way of turning something quite invisible and intangible into something that is visual with a graph. Yeah. Well, Matt, thank you once again for the very informative talk. There's lots of people in the chat saying thank you. Thanks and good night.
Thanks, guys.